Are you somebody who's been previously diagnosed as a Lyme disease patient? Are you somebody who wasn't diagnosed as Lyme disease patient, but you're also living with chronic fatigue and brain fog and lack of strength in your body? My name is Dr. Lonnie Herman, and I'm going to present to you one out of the many different types of cases or different kinds of health presentations or health symptoms or conditions or diagnoses that I work with a man who was, when I first met with him, which was back in, this first exam, I met with him in May of 2017, and I saw him again in August of 2017. This man was at the time when I met with him 51 years of age. He suffered for several years, probably I think it was about 8 years of suffering with what was diagnosed as Lyme disease, and nothing that he did, from IV chelation to antibiotic therapies, IV and so on, of antibiotics and different kinds of herbs and different kinds of supplements and nutrients and diet changes, got him barely anywhere. His wife was so excited when I met with them both again. They came to my clinic in South Florida, where I am presently, from across the United States and California. And there are people who do travel from across the US to even parts of Canada, from even other parts of the world. I've had Belgium, I've had Norway, Netherlands fly in here, I've had New Zealand, I've had patients come in from Italy, and there are other places to think about right now. But Thailand, even as far as Thailand, coming into my clinic for various conditions. But this man, he went from feeling a fatigue level that was at a 9 or a 10 on a daily basis. He told me now it's at a 3. He said now it's at a 3, where he's able to get up and work 8 to 12-hour days. His work had been lacking for so long. His production for himself and his business and his home had been lacking for so many years that now it's catch-up time, is what he said, that he's able to do the work. And even his wife she's worried about him falling backwards, reversing back to the fatigue level, but he's just, for 3 months now, he said shortly after he left here and he started his protocol, he's been feeling so much better, and it's sustained for this just about 3 months, 2.5 or 3 month period. He said it felt like he was 80 years of age. He's 51 again. He felt like he was 80 years of age, and now he feels like in his 30s again, is what he said. His strength was at a 1 when I first met him. His strength is now at a level of 8. So 1 would be really weak, 10 would be great. In this analysis, from 0 is no strength, 10 is great strength. He said he was at a 1 when I met him. Now he feels like he's at an 8, which is phenomenal. He also said that he had headaches, daily headaches. Now 0 headaches for this man. His back pain was horrible. 0 back pain now. His brain fog, he said, was a 10. Now it's at a 3 or a 4 after his first protocol. His sleep is good now. His swelling that he had throughout his body has decreased dramatically. Even though there's still a bit of symptoms in the right arm. His sleep is good. He has no anxiety. He does still have some heartburn, which all, okay. But again, fatigue 9 or a 10 in severity down to a 3. He could work 8 to 12 hours a day. Felt like in his 80s. Now in his 30s, he feels like, even though he's 51. His strength was at a 1, now at an 8. No more headaches, no more back pain. Brain fog went from a 10 down to a 3 or 4. What I found for this gentleman in his first protocol, and I do a very unique bioresonance type of analysis, no computerized device, it's all manual, hands-on, to do this type of very unique stress reflex bioresonance analysis that I perform here. I have samples of different tissues of the body and samples of different bacteria and parasites and fungus and mold and viruses and anesthesia chemicals and antibiotic residues and insecticides and pesticides and preservatives. I have different heavy metals, I have vaccine chemicals. I can find what's driving your condition in your body and help you. We have a highly likely chance of helping you reverse the stress and feel better. The first diseased tissue in his body that helped me start to figure out and unravel his condition and get him such relief so quickly, and which he sustained. Not like he felt good for 1 or 2 days or a week and it fell backwards. He has been feeling good and continued to feel good, feeling much better. His stem cells, they're all known as the I'll put the word up on the side of the screen here, hematopoietic stem cells. His hematopoietic stem cells, which are in all of us, we have cells in our bone marrow which make our red blood cells, they make our white blood cells, and they make our platelets. Your blood is manufactured in a factory called your hematopoietic stem cells. Hematopoietic means the cells that produce your blood. That's what that big word, cells that produce your blood. So the factory that makes his red and white blood cells and platelets infected and toxic. They were infected with antibiotic residue, Streptococcus B, a B group of strep infection, E. coli infection, MSG, neurotoxic food additive flavoring chemical, MSG, organochlorine pesticides, protozoa eggs. He had a bacteria called Yersinia enterolytica. Yersinia enterolytica. Lyme infection in his stem cells. Lyme infection, his next tissue was his brain. Lyme in the brain. Scabies infection in his brain. EDTA chemicals in his brain. Parasitic amoebas in the brain. Protozoa, another kind of organism, in the brain. I found in the various tissues throughout the body, there's a system that we have called the reticulo. I'll put the word up here. Pause it if you got to read it. Reticuloendothelial system. Out of that word reticular, out of the reticuloendothelial word there, the reticular fibers there are, which we made when we were little embryo tissue inside of our mother's womb. We made these reticular fibers that we built our bones with. It's like building a brick house. You need bricks to build a brick house. Well, we needed to create these fibers called reticular fibers that build our bones, or we built our bones with those fibers that we made and built our organs and built our lymph vessels. Reticular fibers of the reticuloendothelial system, bones, organs, lymph. Endothelial of the reticuloendothelial system. This is the inner surface. The word means the inner surface of our blood vessels and lymph vessels. Also, the reticuloendothelial tissues work in concert with macrophages. These macrophages are white blood cells that help us, like a Pac-Man, gobble up infection. So if there's any infection or toxin that's damaging the reticuloendothelial system, it can cause our white blood cells to not work as well. I found Candida cruzi throughout the body in these reticuloendothelial tissues, which will cause inflammation throughout the body because the immune system is going to attack where these reticular fibers are located, where the infection exists, as well as where the endothelial tissue is, which is everywhere, from blood vessels from head to toe. I found his spleen infected with Lyme infection. I found his hypothalamus of his brain, which regulates all the hormones of the body, infected with Lyme. I found his stomach, Lyme infection, Lyme in his kidneys, Lyme in the testicles, Lyme in many areas of the body. But it wasn't the only, Lyme wasn't the only factors that we had to deal with, or infections, hidden infections and toxins, or I'll use another word, pernicious agents or disease-causing agents, pernicious agents in other words, which these hidden agents, infections and toxins that did not come up on blood tests, at least a good number of them, he found Lyme before, but didn't treat it effectively, successfully. But these different infections and toxins like gonorrhea, antibiotic residue, strep infection, E. coli, MSG, pesticide chemicals, scabies infection that didn't show up in the test. These different infections and toxins riddling his body, making him feel sick. In another video I'm going to present with him, when he comes back in the future, I'll present what his second protocol was and what I figure out in the next visit, which I'll see him again in another month or two. So we're going to be able to, I'll present to you what was in the second protocol and what's in the third protocol when I do that exam that day. But he told me when he comes back, he will be very happy to get on video with me and share with you so that you can hear about the progress for this gentleman. And he suffered for a very long time, for a number of years, and spent a lot of his hard-earned money to get well. So that's what this protocol was. In May, when I saw him again in April, he exclaimed how well he was feeling after that protocol. Again, fatigue, 9 to 10 in the beginning before I met him, down to a 3. He could work 8 to 12 hours a day without feeling exhausted. Obviously, we get tired at the end of working all day, but nothing like what he dealt with before. Sleep being good, strength from really weak up to an 8, headache gone, back pain gone, brain fog from a 10 down to a 3 or 4, and doing phenomenal. Share this video with a friend or a loved one who suffers with Lyme disease, who's been diagnosed, where they're trying different Lyme-literate medical doctors or Lyme-literate natural doctors and not getting the relief they want. Share this video with a friend who's got brain fog or got pain in the body or fatigue, and you want to see them get well. And it's very simple, on your phone or on your tablet, just click the share. Or if you're on your computer, just hit that share. Very simple. It's so simple for you to just press a button and share it to someone. And you don't know how far reaching your one click on the button, how much of an impact, positive impact in somebody's life in some other part of the world, your one press of a button can do for somebody else. So really share it, because people deserve to know that they can get well and that I can help them get well, and I will, and I can, and they can. And there's no more reason to suffer anymore with the fatigue and the brain fog and the pain, because we can get it done. No more reason for people to be on the different kinds of medications that are not helping them, because we can get this done for you, for them. Like my Facebook page. I'll put the information on my Facebook page up here next to me on my left side here. And you can even follow me on Instagram. I put useful information up there all the time. Again, on my Facebook, I put useful information up there all the time. Some of that information I put on my Instagram and my Facebook I have not put into video form yet, so I think that you'd find it pretty captivating, literally captivating, when you read that information that I put up there. Subscribe on my YouTube channel here. It's very simple. Look at the bottom corner of this video. You're going to see right there, there's a little subscribe button. You just click on that and you're automatically subscribed. And why would you do a subscribe? Number one, because you're going to be the first one to know when I put up new videos like these, and you're going to get an email message that says, new video on Dr. Herman's, basically, YouTube channel. So you can go and watch that video and have more of an understanding of the kind of very unique and great successful work that I'm doing with patients from around the world with these different kinds of chronic illnesses. You can get well, your friends and loved ones can get well. It's time to get started. Call my clinic. If any of you who are watching this are interested, anybody out there is interested, call the number here at 954-370-3100. That's 954-370-3100. You can even send an email to my assistant at, I don't have to repeat it now, but I'll leave the email address up here for a little while so that you can copy that down if you want to contact her via email to make your appointments. We've got to do a very different, unique investigative consultation. It's not just how are you feeling, how's the pain, what's your level of pain, and what medications have you taken or tried. There's a lot of different in-depth kinds of analysis that I have to do with the patient. And I didn't cover in this, but sometimes there are dental issues that are connected to these concerns. So I do offer a very unique kind of dental examination that I perform in my clinic that I do recommend. There are some people who have chronic infections and root canals and fillings in their teeth that could all be crowns, and that could all be part of it, their condition. Further, if I could just tell you right now that insurance companies do not recognize the kind of work I'm offering. There is no way that I can bill your Medicare or Medicaid or Social Security or disability or HMO or EPO or PPO plan. There is no coding, no insurance billing coding that I could try to send them a bill. They don't recognize that there is no way for me to present a service to them and get paid from the insurance company, and that's just the way it is. So this will be out of your pocket. This is something you're going to invest in yourself, and you're going to see the improvement. Whether it's for you, you're going to heal faster than another person heals, or if it's going to take you more time than another person, you will get the result of getting the relief. It's just, will you heal faster or slower? That's impossible for anybody to predict, but you are going to get the relief that you're searching for. Again, call my clinic, 954-370-3100, and I look forward to helping you.